Let's talk about diverticulitis, crampy, gassy pain. There's a difference in the two. What is diverticulitis, and what do you recommend for those people?
So diverticulitis is an inflammation, infection, irritation of the diverticulosis. So as we grow, some air pockets form in the lower GI tract and sometimes in the small intestines and upper GI tract, but mainly in the colon, mainly even in the left side of the colon. There are air pockets that pouch out of the colon. Sometimes people get issues with this. These get infected, they get inflamed, they get bacteria seeds inside them, they go bad, they cause a lot of pain, diarrhea, constipation, sometimes even they can be very scary, can be even deadly. So that's when we call them diverticulitis.
And diverticulitis, the itis would mean inflammation. The osis just means sort of morbid condition. Well, if somebody has diverticulosis, what kind of diet do you give them?
So there's a lot of old data and old say that people cannot eat popcorns, corns, and seeds, and that is not true.
So it's not true.
It is not true.
As far as diverticulosis and diverticulitis goes.
Sure. People can eat them. This is all pretty much myth, and it's gone.
So what do you do to help the diverticulosis not go into itis?
So we ask patients to avoid constipation, to drop the pressure on the colon wall. That's what we try to do. So we ask them to do a high fiber diet. Fiber has been proven to prevent the itis, the diverticulitis sometimes, and even prevent bleeding from those air pockets.
Wow, so fiber is important.
Yeah.
How do you know, we're reading labels better on food, and it tells us how much fiber is there. What kind of fiber do you recommend a patient use? Because there are some GI recommended ones, FiberMed, and so what do you like, John?
So when we speak about fiber supplements, there's a soluble fiber and an insoluble fiber. For people with diverticulosis and they have no other problems, I like something soluble, maybe something like Benefiber, which is a wheat dextrin, or maybe something like psyllium, like Metamucil. They can still do something insoluble like Citracil.
So do you have to take those every day? Do you take them twice a day? Those are the ones that are sort of over the counter. If you get those, how often do you know how to take them, and can you overdose on fiber?
You could overdose, but
you
could do anything. But usually it doesn't happen. I usually ask them to do a half a tablespoon and then go up on how much they can take a day, because it makes them gassy. And they have to drink plenty of water with it. I asked them to aim for 8 glasses of water a day.
8 glasses of water. Now, do you like water? There's water in almost every food and stuff. Just good old, I call it aqua pura, pure water.
Absolutely.
So that gives you hydration. And the fiber, does it like the water to make it bulky so the GI tract works better?
So there's two forms of fiber. You have the soluble fiber, and it's like dropping an oat in a water, so it gets expanded. And there's stuff that doesn't really get expanded as much, like if you drop a piece of celery. So, as you said, the stuff that goes gelatinous, they're better. They give you that bulk, and they travel throughout the gut. The bacteria likes them, they break them, they eat off them. It's good stuff.
Good stuff. So it helps regulate the gassy, crampy pain sometime. If you try things and somebody comes back and says, my belly's still bothering me, where do we go then?
Well, sometimes the fiber can give them gas. So sometimes we have to kind of go back on gas a little bit.